Hi, I'm Dr. Ken Muhich from the Fibromyalgia Wellness Center. I'd like to speak to you today about something called white smoke, or secondary conditions that fibromyalgia patients have. I've been working with fibromyalgia patients since 1990, and in this entire period of time I've never come across a fibromyalgia patient that does not have at least one or more secondary conditions. And fibromyalgia usually magnifies and makes those other conditions worse. You know, if you check my website, fibrowellnesscenter.com, you'll see many of the blogs that I've written, and many of them involve a lot of the secondary conditions that I am talking about. Everything from rheumatoid arthritis to osteoarthritis to MS to you name it. Many of them have symptoms that are very, very similar to fibromyalgia patients. And so what we try to do when a patient first comes in is we try to do orthopedic and neurological tests and a number of other tests to evaluate and find out what secondary conditions a fibromyalgia patient has, so we might be able to treat those or actually work with those separate from the fibromyalgia. If we don't do that, they really will complicate fibromyalgia itself and the actual treatment that we try to offer to the patient. So keep that in mind when you by chance have fibromyalgia, or you know someone that has fibromyalgia. They do have secondary conditions, of which they can be wide and varied as possible. And when they come into the clinic, we make sure we try to differentiate those, treat those separate from fibromyalgia. Once we do that, we can actually take care of the fibromyalgia and have a much more successful evaluation and treatment protocol for the patient itself, and a much more successful ending to their treatment. Thank you. This is Dr. Ken Muhich, Fibromyalgia Wellness Center. Again, we're always glad to see your back in other body parts. Thank you.